Treatment of plantar fasciitis. There are numerous ways to treat plantar fasciitis and heel spurs. In my practice, treatment is based on the length of time the problem has been present, and the severity of the pain. A patient who developed plantar fasciitis yesterday as a result of hiking, should be treated differently than the patient who has had heel pain for 3 months. Conservative treatment for plantar fasciitis. Orthotics. An orthotic is a device that fits in your shoes and supports the arch and plantar fascial ligament in an effort to keep it from overstretching when walking. For that reason, an orthotic has to be the cornerstone of any treatment for heel pain. I have found that pre-made orthotics in many patients work quite well. Unless you have an extremely high arched foot or very rigid low arched foot that requires a custom orthotic, a pre-made orthotic can be very effective. Foot strapping. In acute episodes of pain, strapping the heel can be very effective in reducing pain. Short-term oral anti-inflammatory medication. This can be very helpful in those who have been suffering for a while, and for those whose symptoms just began. People with acute pain tend to respond better, and in many cases this may be all that they need. Cortisone injections. They may be helpful, usually done in a series of 3 over a 3-week period. Physical therapy. I usually reserve this for patients who have been suffering for some time. Night splints. During the night the plantar fascial ligament will tighten up from lack of use. The first steps that people take in the morning can be very painful as their body weight stretches out the ligament. The use of a night splint can be helpful in certain individuals, to keep the ligament from tightening up and thus making those initial steps in the morning far less painful. Walking cast. In very severe cases including partial tear of the plantar fascial ligament, a walking cast can be very helpful. Plastic heel cup. Another type of heel pain may be caused by nothing more than a bone bruise and actually have nothing to do with the plantar fascial ligament. Aggressive treatment for plantar fasciitis. Extracorporeal shock wave therapy. The science behind this is the same theory used to break up kidney stones. Shock wave therapy. It is high-power ultrasound directed at the site of pain. Platelet-rich plasma therapy. The patient's blood is drawn and spun down, creating a small amount of platelet-rich material. PRP contains growth factors and bioactive proteins that influence the healing of tendon, ligament, muscle, and bone. This material is then injected into the heel at the site of most pain. Topaz glutathione therapy. In this procedure a number of small holes are made in the area of the most pain. A needle is inserted into each hole and an electrical charge is given off. The electrical charge results in microscopic cutting of the plantar fascial ligament, creating an increase in blood flow, and breakup of the scar tissue that may be present. Even though this is a relatively minor invasive procedure, there will be some downtime following the procedure as recovery can be slow and somewhat painful. Dry needling, whereby anesthesia is first infiltrated into the heel area. Then using ultrasound guidance, an empty hypodermic needle is inserted into the plantar fascial ligament in the area giving the patient the most pain. This is repeated multiple times. The idea is to create more blood flow. Radiofrequency nerve ablation. A probe is inserted into this area and radiofrequency energy creates heat in a very small area, which disrupts the myelin sheath, the outer covering of the nerve. Disruption of this sheath no longer allows pain sensation to be carried along this particular nerve, and thus the pain is eliminated. Surgical intervention. Lastly, when all else fails, surgical correction should be entertained. Today's foot specialist is trained in doing both conventional large incision procedures and minimal incision procedures. Keep in mind that surgery for a heel spur or plantar fasciitis can have a very long recovery period. Read the full article at www.foot-pain-explained.com/heelpain.html